Myself, Dr. M.L. Garg. I am the chest specialist from Muzaffarnagar. I have completed my graduation and the post-graduation in the medical field from the King George Medical College, Lucknow. And I have joined the government services and remained in the government services till 1976 to 2010. And then I came in the practice and doing my practice at my Nath clinic since 2010. And I am doing my practice as a chest physician, consulting chest physician till that date. Now, I want to tell about the latest update in hypertension. As per WHO, nearly 63% of total deaths in India are due to non-communicable diseases, of which 27% are attributed to CVD, which affects 45% people in the 40 to 69 age group. Raised blood pressure is among the most important risk factor for CVDs. Moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow-up. Number one, in India, the prevalence has also gone up over 30 years to 38% in men and 32% in women, from 29% and 28% respectively. WHO, despite that, nearly half of the people, or 51% of the men and 41% of the women with hypertension were unaware of the condition. Additionally, over 62% of the men and more than 53% of the women living with hypertension did not get treatment. Medication was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women with hypertension worldwide. WHO Lancet 2021 398 957 280. International Society of Hypertension, ISH, has released the ISH 2020 Global Hypertension Practice Guidelines. The inclusion of optimal and essential treatment paradigms attempts to address that issue that in resource-poor settings. Optimal care refers to evidence-based standard of care, and whereas essential standards refer to minimum standards of care to allow specification of essential standards of care of low resource settings. The AHA/ACC has released a scientific statement in 2021 offering new guidance for the management of stage 1 hypertension among patients with low ASCVD risk. Among low risk adults means no ASCVD or 10-year CVD risk less than 10%. With stage 1 hypertension, blood pressure that is 130 to 139 to 80 to 89 diastolic millimeter of Hg. Management starts with non-pharmacologic therapy. If blood pressure remains uncontrolled at 3 to 6 months, consider starting pharmacologic therapy. That is by Jones, D.W. et al., Hypertension 2021, 77, 858 to 67. Acute respiratory distress syndrome is potentially fatal condition involving lung damage, and experts often associate with severe COVID-19. A recent study which appears in the Journal of the American College of Cardiology reports that metoprolol can reduce lung inflammation and improve respiratory function in people with COVID-19 induced ARDS. That is published in JAM Call Cardiol 2021 September 78 into 10 and 100121111. lowering systolic blood pressure targets down to the 110 to less than 130 millimeter of Hg range substantially reduced CV adverse events in the STEP randomized trial, affirming the sprint finding for an older Chinese population. Among some 8,500 patients ages 60 to 80 in China, the intensive target trimmed 26% of the composite CVDs. Findings from now a second major trial supporting a lower target could unite the guidelines, which even among US professionals, societies range from threshold of 130 to 150 millimeter of Hg. With regard to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure, the 2018 European guidelines on the management of arterial hypertension recommend that the diagnosis of hypertension should only be dependent on office BP measurements, but also an out-of-office measurements such as ABPM or home blood pressure monitoring, that is HBPM. 24-hour and nighttime BP measurements were associated with greater risk of mortality and a composite of CV outcome. Thus, they may be considered as the most relevant measurements for estimating CV risk. For every 20/10 millimeter of Hg increment of BP measured at night, the risk of mortality increased by 23% and the risk of cardiovascular events by 36%. Most patients with hypertension require lifelong medical therapy to achieve optimal BP control. The 2018 European guidelines equally recommend 5 classes of antihypertensive drugs considering high non-adherence treatment. The importance of combination treatment is particularly highlighted to improve adherence to therapy and BP control. Therefore, 2018 European guidelines recommend, especially in the context of lower BP targets, to start antihypertensive therapy with an initial dual fixed dose combination of ACE1 or ARB plus CCB or diuretic. Since early July 2018, products containing valsartan have been recalled worldwide. The reason is the detection of a known carcinogen, namely NDMA, which can be found in candesartan, irbesartan, losartan, olmesartan, and valsartan. NDMA has been classified for research on cancer to be carcinogenic in humans. If 1 lakh patients would have received NDMA contaminated valsartan from Zhejiang, Huai, that is manufacturing site where the highest levels of contaminants were found every day for 6 years. In the highest dose, it could result in 22 additional liver cancers over the lifetime of these patients. The presence of NDMA in these drugs could lead to 8 additional cancer cases in 1 lakh patients if they had taken the highest daily dose over 4 years. Valsartan recall accompanied by a significant increase in the rate of emergency department visits of +6%. The Hygia study represents the largest study that tested nighttime antihypertensive treatment. In this trial, chronotherapy was associated with a significant reduction in endpoints, including death. The Hygia chronotherapy trial tested where nighttime therapy in combination or unusual upon awakening hypertension therapy exerts a favorable CV risk reduction. The largest study in included a total of 19,084 hypertensive patients. During an average follow up to 6.3 years, 1,752 participants experienced the primary CV outcome. An ambulatory BP measurements was performed for 48 hours to collect data on how BP deferred during sleep. The RR reduction for CV events was significantly improved for nighttime treatment when compared with awakening treatment. Thank you.